live video. The funniest thing is that, oh God, can you hear me? Let's see. Where are my followers on YouTube? Where are they? Where are they? Where are they? Where are they? I'm live. Let's give them some time to show up. Like, you understand? People are getting notification now, they're checking their phones. Let's give them some time to show up. Who is live? Drop on the comment section. Where are my subscribers? Okay, it's work time. Oh, most of them are busy at work. If you're live, just drop in the comment section, okay? Hello, Simo, Olusayan. How are you doing? Hope you're doing great. Yeah, they're coming live. If you are live today, just drop on the comment section. Miss Mary is live to take all your questions as usual. You see this live, sometimes I want to program it on this particular day. I'm going to come on live, but when you are a mother and you have a child to take care of, you can't really predict when they are sleeping. They might decide to sleep by 2 a.m. today and tomorrow they'll sleep another time. So it's really cumbersome trying to fix my live video. So whenever I have the opportunity, I pop up quickly to take all your questions. Okay, we have a lot of questions popping in already. Good. Bam, bam, bam. Hey, and let me hold my other phone in case. Okay, how are you guys doing? If you can hear me, say Messi, I can hear you. And please, I will appreciate if you tell me where you are watching from. Please, I will also appreciate if you drop the like. Click on that like button, please. Like, please. If you've not been liking our video, kindly like the button. I will really and joyfully appreciate if you like the video. I'm saying if nobody is liking, it's not fair. I'm saying like nobody is liking. I hear you. Okay, thank you, Kamara. So I'm going to be calling the names of those present. Simon Olusayan, thank you very much. Agatha, thank you. Onyechi Modestal, thank you. Hawa Rogers, thank you. Little Princess, Shaidu Asabe, Kamara, Blessing, Abe, Godwin Emmanuel, Yabo, Chimere Mama, Rogers, Bernard. Hello, all, and how are you doing? Rogers is watching from Sierra Leone. Simon is watching from Rivers. Please, wherever you are watching from, kindly drop in the comment section. Though this is the work time, people are at work now, but for those that are here, see it as an opportunity to ask your questions and get answers to them all. But before I start answering your question, there will be a live video on the 4th of October. Take note, turn on that notification bell so you don't miss out. There's a live video on the 4th of November with Dr. Tasha from UK. She has over a decade of experience. She is a breast surgeon. Yes, please take note, turn on that notification bell so you don't miss out, especially for the ladies. The video is not just from the men, for the men alone. It's also for the ladies and also for the men. So please, this video is going to help you know more about the breast. If you are having any complaint, any myths, any discharge, any question you really want a surgeon to explain, a breast a specialist to explain, I would advise you be on that live video on the 4th of October 2023. Dr. Tasha will be here to take all our questions. It's a privilege to have a breast surgeon with over a decade on our YouTube channel. Please make do of this. I've come to give you what I know, but Dr. Tasha is more experienced than me when it comes to matters of the breast. So I would advise you bring all your questions, all your doubts on the 4th of October, which is this Wednesday by 5 p.m. Nigeria and the UK time. This Wednesday by 5 p.m., Dr. Tasha will be here to take all your questions in regards to the breast. Don't be shy about it. Your health is very important. If you are shy to communicate with your doctor, communicate with Dr. Tasha, and definitely I believe she's going to tell you what to do and how to go about it with your GP and also your doctor. So thank you very much for all those that have been staying tuned. Turn on that notification bell so you don't miss that appointment with Dr. Tasha. All right. Okay, so I'll be taking all the questions now. Let's do it one after the other. So I got a question from Godwin. He said, "Good afternoon. I am the type that does not last on bed. What should I do, please?" Okay, you can see I am on my scrub. So I just finished making a video on the various type of ejaculation, and one of them was premature ejaculation, what causes it, and what you should do. And I've made a video on how to cure premature ejaculation that talks about premature ejaculation. So what you can do is to watch that video. That particular video has 1.7 million views at the moment because the video has a lot of information about premature ejaculation. I will also advise you watch that video. But let me give you a general advice. When it comes to not lasting on bed, premature ejaculation, you have to know what is causing it. What is actually causing this premature ejaculation? One of the common cause that is not popularly talked about is stress. So if you were usually active before and all of a sudden you are no longer active, you no longer last longer, stress could be one of the cause of premature ejaculation. So you have to take note of that too. I'm checking if my daughter is crying. So that is that is one of the way to go about premature ejaculation. And also, once the cause of that premature ejaculation is noted, it is easier to treat it. But if the cause, you don't know the cause of that premature ejaculation, it will be difficult to treat. So we have to know what is causing it. Have you done any test in regards to it? Do you have any issues with your prostate? Are you diabetics? Do you have anything? Just first of all, we have to know what is actually causing it. Are you depressed? Are you stressed out? Are you anxious? Because some things that we don't talk about is that when a man wants to have sex with a new sex partner, he might be anxious about that sex partner. Am I going to satisfy this lady? Am I going to satisfy this woman? What if this woman wants more? So thoughts like that can actually affect your sexual performance. Not even believe these are things we don't talk about. I'm not talking about the health causes now. These are the little things that are likely going to cause premature ejaculation. So Godwin, I would advise you watch the video. If you've watched the video and still you are not getting a better understanding, then we can talk further in regards to that. Okay. I think Chimere, he also asked that question. I don't last long in bed. I think this not lasting long in bed is now a popular issue. You are not alone in it. That's something I want you to know. You are not alone in it. A lot of people are battling with it, premature ejaculation. Possibly, we're going to be getting somebody like maybe a specialist in that feed on the YouTube channel to explain in details why a lot of men don't last. Some men, not a lot, I would say. Let me not use a lot. I didn't do any research on it. So why some men don't last long in bed. But you can watch the video and get how to go about it. I have a video on that. It has 1.7 million views. So easily access it. Search Nurses Lecture Room. Look for my most popular video. It's one of my most popular video. It explains a lot of things there. Hope I'm not too fast. Let's see the other question. It's a good afternoon, ma. Please, I have an inverted nipples. Please, what should I do to pull it out? Inverted nipples is normal. Like there are different types of nipples. For this question, what I will advise Asabe, wait on Wednesday and answer this question. You're going to get a precise answer that's peculiar to this. So Dr. Tasha is going to answer it. Let me not touch on the breast today. Because on the 4th of October, Wednesday, please just turn on that notification bell. She's going to answer all these questions for you. So Asabe, take note on the 4th of October, that's on Wednesday, this Wednesday, just be present on our YouTube channel live. She will be here to answer this particular question. I'm going to screenshot it. In case you are not live, I will ask it on your behalf. But please just stay live so that it's easy for you to get answers and ask further questions. Okay. Blessing said, okay, Asabe is from Kogi State. Nice meeting you all. Blessing said, Nurse Mercy, please, what is the possibility of pregnancy after HSG test? Blessing, if you are here, just say hi. Just drop in the comment section before I answer, because this particular question is peculiar to you. Blessing, just drop hi on the comment section. I'm using stage to check. God. Checking on my daughter, using my ears to hear. Blessing, are you online? I want to take your questions, please. Blessing, if you are online, drop hi. I'm here so that I can answer your question, and I am sure you are here. Okay. Blessing is here. What that HSC does, it doesn't do anything bad. It only checks. So the result of the HSG is what determines. What does the result says about the HSG check? Because HSG test is just like it. You know when you go to blood, when you go for blood test, they take some sample, they do some tests, then they tell you, are you malaria positive or malaria negative? That's what this HSG test is. It's a fertility test. So the results of the test determine the possibility of pregnancy. I don't know if I'm making sense, Blessing. So the result of your HSG test determines the possibility of pregnancy. If you understand what I'm saying, Blessing, just drop in the comment section. Okay, Blessing, understand what I'm saying. Then Tanga said, please help me, ma. What is varicocele and how does it affect a man? Okay, varicocele is like, how do I describe it now? It affects the veins basically of a man around that scrotum area. Let me look for a good definition for you. I'm coming, just give me some time. Just give me some time. Let me explain proper because I don't want to go out of the point. Okay, a varicocele is an enlargement of the veins within the loose bag of skin that holds the testicles. That's the scrotum. There's enlargement of the veins around the scrotum. So that is what's varicocele. You see the scrotum in the man, that scrotum bag, there's enlargement of the veins around there. So that is what varicocele is talking about. Tanja, can you hear me? Tanga? Okay, she's asked another question. How does it affect a man? Tanga, can you hear me? If you can, just say hi. What is varicocele and how does it affect a man? Okay, yeah. So varicocele, like I earlier said, is like the veins are being affected. How it affects a man is that it can affect fertility. It can affect the sperm. It will make the temperature of the sperm, that's the temperature around that area, high. So it can affect the sperm production. It can affect, it affects the sperm. That's what I know about varicocele, please. So that is that. It's just the vein that is being affected. It's going to cause blood flow restriction. You know when something is enlarged now, it's going to affect the organs around it. So that is varicocele. What are the causes of indigestion in the stomach and what is the possible solution? What signs are you having that made you feel you are having indigestion? One of the cause of indigestion is that I know that is common is okay, after eating, you just going straight to lie down. Like that's going to cause indigestion. And the type of food you eat too causes indigestion. If you don't eat more of fiber, like fiber fruits, like you don't eat more of fruit to help, because there are some fruits, there are some food that aids digestion. So if you are battling with indigestion, you can take a lot of fiber, you can take some fruits to help with digestion, to help the food easily digest and the food goes properly in the body. Fatima Adegoke says, Nurse Mercy Mary, please, can boric acid work for discharge that we have been nursing like 3 to 4 years now? Depending on what is causing that discharge, Fatima, the particular thing that is causing that discharge, because what boric acid help with is recurrent bacterial, recurrent yeast infection. When you are having frequent recurrent yeast infection, that is where doctors prescribe boric acid. So it depends on what is causing that particular discharge. So if it's as a result of yeast, then boric acid can do do a lot of good to you. All right, depending on what is causing that discharge, do the appropriate test. Then if boric acid is advisable by your GP or your healthcare provider, you can go ahead and give it a try. Definitely it's going to work, because I've seen a lot of ladies that are experiencing this discharge as a result of yeast infection, and it helped them quickly and promptly. All right. So exquisite asks this question. She says, Mary, Nurse Mary, what causes slight abdominal pain 8 days after conception, ma? Let me explain it. Like, it's possible when the egg is fertilized, it goes into the womb, the baby is trying to implant in the uterus, the baby is trying to fit itself. For example, is there something I can use now? Okay. For example, I'm just using this as an illustration. For example, this is the womb. The baby goes there. The baby is trying to stay, it's trying to stick to this wall, trying to arrange itself to this wall. That might be also be the cause of the abdominal pain you are experiencing during that first week of conception. But if it is intense, it is not bearable, speak with your doctor. Yes. Because when it comes to pregnancy, anything that is not bearable, that is giving you sleepless night, that's disturbing, it's better for you to speak with your doctor and the doctor tells you everything is fine than for you to assume everything is fine and something is wrong. All right, exquisite. Please like the video, drop your questions. I've taken all questions here. And if you have any question, I'll be live to answer as much questions as I can. Bernard, have you gotten answer to your question? Exquisite, did you hear me answer your question? Fatima, did you get me? Did you hear me answer your question? If you got it, just drop on the comment section. Oh, thank you very much, Blessing. I appreciate the beautiful comments. Thank you very much, Blessing. Drop your questions and I will take them all, please. Is there any question? Okay, Exquisite got my answers. Okay, there's one question. Why is he hiding? Let me open it. Sorry. Tanga said, coming back again, does varicocele affect erection or quick? Most people that experience varicocele usually complain of premature ejaculation, which is quick ejaculation. So I am going to say that it affects it. So varicocele affects ejaculation. There's swelling around there, and definitely there's going to be discomfort for the man. There's going to be discomfort for this particular man experiencing that. So that's going to affect how long he's going to stay. Because most people that come up that I've seen with varicocele, they usually complain of premature ejaculation, as they are coming quickly. All right, Tanga? Okay. Then Lauren says, what is the work of drinking warm water does to our body? Okay, warm water generally is good. I'm not saying very hot water. I'm not saying very hot water. Warm water is good. It's kind of clean. We believe it cleans the body. But I would like to let you know that too much of water, I've heard about water toxicity. The news trend, like there was something trending on the internet where it talked about a woman who drank a lot of water and died. Yes. So whether it's warm water or cold water, we just have to be careful. Everything should be done in moderation. Drink as much water as you can. Drink warm water. Warm water generally helps to cleanse the body. Yeah. I personally experience it. Whenever I take warm water in the morning, I get this refreshed feeling in the morning. Not cold water, warm water. Like I get this refreshed feeling. Water generally is good, be it warm or cold. But take everything in moderation. Don't intoxicate yourself with water, but drink as much water as you can. I don't know if I'm making sense, Lawrence. Michael Favor, good afternoon, ma. How are you doing? And baby, she is fine. I'm doing live and I'm also keeping my ears down to see if she has woken up so I can end the live. Once she wakes up, I'm going to end this live. All right. So just know. Thank you. Okay. Okay. Normala. Who is that? Norman Keku Laha. He said, I can hear you. What is orchitis and how can it be cured? Okay, you know the testicles. When the testicles are inflamed, they are swollen. That is what is known as orchitis, inflammation of the testicles. And the cure for it depends on what is causing it, because it can be caused by bacteria. So if it's a bacterial infection, they will have to treat it with antibiotics. All right. So it depends on what is causing that orchitis. That's what you have to look into as a man. So find that, let your doctor be the one to do the findings for you. Then the doctor will be in a better position to tell you the treatment. All right. So orchitis is simply the inflammation of the testicles. Do I make sense? I just received a message from Dr. Tasha. Please, let's get ready for our Wednesday. Please and please. She just sent me a message. The message popped up. Okay, let's see. Norma, did you get my answer to your question? Please, if you do, just let me know that I've answered your question. And sexually transmitted infection can also cause this orchitis. Sexually transmitted infection. So you have to know what is caused it. That will determine the cure. So I can't say it's this cure. What caused it determines the cure. But just know that orchitis is simply the inflammation of the testicles. It can be cured, but it depends on what is causing it. All right? Okay, please, ma, what is the disadvantage of Postino 2, especially misoprostol? Okay, in terms of Postino 2, we know that Postino 2 is an emergency contraceptive, which is used to like prevent pregnancy. There's something I want to tell you all about Postino 2. I think this is the time for me to say it. I've made a video on it. There are times you will use Postino 2, it's not going to work. When you use Postino 2, when the egg in your ovaries is already released out, that Postino 2 is not going to work. But when the egg has not been released and you use Postino 2, fine, it's going to work. All right. Then for those that are asking about the disadvantage, one of the disadvantage of frequent use of Postino 2 is that it alters your cycle, because every time you're trying to delay menses, you're trying to delay your ovulation. And you know, when your ovulation is delayed, that's definitely going to affect when your menses is going to come up. So it's going to alter your cycle. It might not give you that regular cycle you are seeing. If you used to have 28-day cycle and you keep delaying the release of your egg, your ovulation, that is likely going to affect your cycle. And that is not good. And generally, I would say too much of everything is bad. For those that keep using Postino 2 every sexual intercourse, after every sexual intercourse, it is not advisable, because some research say it's going to affect your womb, but most research are not in support of it. But what I would advise, don't use it frequently and consistently. If you know you want to be having sex and you are scared of getting pregnant, you can choose other family planning method for safe sex, because with Postino 2, you are not certain, especially if you don't know your cycle, you're not certain if it's going to work or not. All right. Michael Favor says, please, ma, what causes vaginal dryness and what can I do to stop it? Because it is affecting my intimacy with my husband. First of all, Favor, are you having any itching? That is one. Are you having any infection? That is another thing. So I made a full video about vaginal dryness. You can watch it and get an insight about it. But one thing I want you to note is that when it comes to sex, you as a lady, you have to put your mind in it. Like, I've come to enjoy this. That's going to help you get wet when your mind is fully in it. Like, try as much as possible to put your mind in it that you want to enjoy it. That's going to go a long way to help. If you've watched our video and you see that your vaginal dryness is not really something that needs medical attention, during sex, you can tell your partner to actually try lubricants. Some lubricant is going to go a long way to make that area slippery. Because for some women, at the beginning of sexual intercourse, they look dry. But when they use a little bit of lubricant at the beginning and they go steadily, before you know, they start releasing their own fluid and they get wet. So lubricant is one way to help during sexual intercourse, because when you are dried, it's going to make sex look annoying and painful for you. It can even cause vaginal tear. if care is not taken. So I would advise people to watch our video on vaginal dryness and the causes. That's going to explain it too. Leah said, otitis and how can it be cured? I've answered it, Leah. I answered this question. Please, if you ask questions, just stay online. Wait till you've heard your answers before you go. Because me repeating it over and over again is not nice. It's draining my voice. I said otitis is the inflammation of the testicles. The cure depends on what is causing it. It can be as a result of bacterial infection. It can be as a result of sexually transmitted infection. But whatsoever the cause may be, that is what determines what the doctors will be using to cure it, what the doctors will be using to treat it. Though some cause of otitis are unknown, but in all, speak with your doctor. The cause will determine the treatment plan your doctor is going to give you. All right. Taiwo, what could be the reason why some people with SS genotype do not have issues? Why they don't have issues? Because they are managing it properly. But most SS people I see, they usually go down with some signs and symptoms. But if it's well managed properly, definitely they will hardly go down with some signs and symptoms. They avoid height, anything that will increase their, should I say, oxygen consumption. They try as much as possible to avoid it. When SS is properly managed, they might not have issues. The issues might just be slight. But most SS I've seen, they usually have pain, they usually have crises and all that. Ochonu said, must you experience implantation bleeding to show that you are pregnant? Some women experience it, but they don't know that they have implantation bleeding. Yes. Personally, I didn't notice mine. That's my experience. I didn't really notice my implantation bleeding. I didn't notice it, seriously. So not everybody will experience it. It might be there, but you will not just notice it because it's tiny, just pink sometimes, just pink. You might just go into the pants. The color of your pants will not make it obvious that it is that. I don't know if I'm making sense, Alice. Okay. Jerry Bad DJ say, what is the difference between UTI and STI? I'm going to explain. UTI is urinary tract infection, and STI is sexually transmitted infection. So STI is transmitted through sex, but UTI is not transmitted through sex. UTI can be transmitted by the toilet you use. Poor vaginal health, poor down there health. When you don't take care of those things, can cause UTIs. So UTI is not transmitted through sex, but sexually transmitted infection, as the name implies, is transmitted through sex. Laha, I've answered that question several times. I've answered your question several times. Thank you, Laha. Nothing of such. Favor, what was the question Favor asked me that she say nothing of such, ma? Nothing of such in what aspect, please? Can this too, especially misoprostol, cause infertility? Like I earlier said, it can alter your cycle, give you irregular cycle. And you know, when you have irregular cycle, it will be difficult for you to trace your ovulation and for you to get pregnant. So it might affect fertility. But most research work that I've seen does not give a direct answer saying, okay, it affects fertility. But it might, in the sense that when you are unable to calculate your cycle, you don't have a regular cycle, it is difficult to know your ovulation date, and it's difficult for you to get pregnant. Okay, and Nimobor, thank you very much. I appreciate what you do, like job. Thank you very much. I appreciate you for the comments and feedback. Let's see. He say, hello, madam. Please, when I get my period and if I have sex without protecting myself, will I get pregnant? See, the possibility of getting pregnant when you are on your period is very low. Yes, it's slim. The possibility of getting pregnant when you are on your period is low, but it's higher when your cycle is short. Like for those that have short cycle, especially those that see their menses twice a month, there's a possibility of getting pregnant when you are on your period. There's a possibility of getting pregnant when you are on your period for those that have short cycle. All right. So it all depends on your cycle. Oh my God, I have a lot of questions already. Okay, people might say, what are the difference between regular and irregular period? Because I thought regular period is when your menstrual cycle is always 28 days and not this month 27. Okay, regular period is that if you notice that every 28 days, every 29 days, even every 32 days, you are seeing your menses. That's a regular period. It's regular because every this particular figure you are seeing your menses is regular. Like if my cycle is 32 days now, every 32 days, I am sure that I'm going to see my menses. That's the regular cycle. For irregular, this month it might be 32 days. Next month is 28. Next month is 35. So that is irregular. It's not stable. You can't even ascertain your ovulation because this month is 27. Next month you count again is 35. Another month you count again is 40. Another month you count again is 26. So that's irregular period. But regular period, if every month you are seeing it 20, every 32 days, every 28 days, every 26 days, that's what we say regular. Okay? Somebody said the SS genotype patient is a local farmer who is not educated at all. Wow. Seriously, Taiwo, that's really interesting. What am I going to say now? Should I say it's the food that this person is eating? I don't really know, but that looks interesting. If that child is stressed out, is also busy doing strenuous activity, and this child is genotype is SS and is doing well, that's something I need to really look about, Taiwo. Can we have a conversation with that particular child? If possible, it would be nice. Seriously, Taiwo, do you want us to have conversation or the parents doesn't want public eyes? Just let me know because most people I see that are stressed out, they usually have a sickle cell crisis. But I'm going to research more on it. I can't really give answers to that now, why it's quite different. Bernard, yes, Bernard, I made a video on that today. This is it. Bernard, you're going to be getting the full video. I made a video on, you can see something like protect your penis. I made a video on how to keep the penis healthy. And I made a video on when to see the doctor in regards to your penis. When you're having any abnormality in your penis, when to see the doctor. So, Bernard, your video is coming soon. I made that video today. So, before the end of this week, you are going to get that video. All you have to do is to stay tuned to the channel, watch, and get informed. So, that video is coming soon. Just be patient. Let me not start dishing. That video has a lot in it. Turn on the notification bell so you don't miss out because this month of October I am on annual leave, so I am basically free. I'll be doing more educational videos. I'll be uploading back to back every day because I have a lot of questions on the YouTube channel that I have not been able to answer. So that is why I am using this annual leave to make as much videos as I can to answer all your questions. So trust me, this month of August is about you. Yeah. Okay, somebody asks, please, can Primolutes N be used as contraceptive for preventive pregnancy? What is Primolutes, please? What is it made up of? Don't mind me. I don't know everything. I've not heard about Primolutes. Let me check Google, then I'll see what is the constituent of Primolutes. I don't know anything about Primolutes. So let me see. This is me checking Google for Primolutes. I want to know what it is made up of. Primo. You said Primolutes N. This is the first time I'm hearing it. Don't mind me. Humulus N. It is used to treat a number of disorder of the menstrual cycle. Oh, for irregular period. They said it's used to treat painful. It doesn't prevent pregnancy. It doesn't help prevent pregnancy. What it does is that it helps to treat irregular period, painful period. That's what it is. So for those that are having painful period, they are having irregular period. That is what Primolutes is. That's what Primolutes N help with. That's what I saw on Google. So I have no idea about Primolutes before. I've not really researched about it, but I decided to check Google and I found out that Primolutes is just used to treat irregular period. It's used to treat heavy menses for those that are having heavy menses. So that's what Primolutes N is used for. So maybe I will research on it, find out about Primolutes, since I'm taking a lot of questions this period. So I'm going to write it down. If you want me to make a video on it, Ghana TV, STG Ghana TV, just let me know. I'll make the video for you. Find out more about Primolutes and come and answer for you. 30. So that's Primolutes N. Any question I can't answer, what I will do, I will write it down, go and research on it, and make a video for you. So this is the first time I'm hearing about. I've been hearing about Primolutes, but I've not really taken it in, like, you know, when you just whisper, but you've not really taken it into your brain to find out what it is. Don't worry me. Because these days I'm more or less like in the theater. So I hardly see. Okay. Olusanya asks, why is it difficult for other women to squirt? That's a big question, oh. That's a big question. One thing I just advise, whether they squirt or not, just find out if both parties are okay after the sex. Just communicate after sex. They squirt or they did not squirt. Ask, did you enjoy it? Did you have fun with it? Like, what do you want me to work on? What styles are best suits you? So one thing is just to ensure that everybody is fine after sex. So I can't really tell you why it's difficult for women to squirt, because from research work, they show that some women will not even squirt throughout their life. So you should not be focused more on squirting. You should be focused more on the bonding and the quality of sex both parties are having. That's what I feel. That's my take. Pianists. Oh, do you want to play a pianist for us? He said, when I have sex with my wife, she always has vaginal tear, and she says my penis is bigger. Please, what should we do? You can see, and somebody's food is another mass poison. Let me put it that way. So some ladies out there, they are there looking for, they need a bigger penis, while some are like, it's too big. So what I would advise pianists is that it's possible your wife's vagina is dried. You can try lubricant, and lubricant is going to help with easy penetration. Yeah, when you try lubricant, it's going to help with easy penetration, makes it easy for you to penetrate. Because when she's dried down there, penetration becomes difficult, and that's going to lead to tear. And definitely when the woman's vagina is torn, I bet you it's going to be hard for her to enjoy that sex, because she's dried during that process. She's not enjoying the flow. She's not enjoying anything in regards to that sex. So have a conversation with her. Ask her, should we go for lubricants? Do you feel you will be comfortable? Let's use lubricants for easy penetration. So that's going to go a long way to help. And some women have what's called the vaginismus. Vaginismus is like a tightened vagina, like it's very tight. If you want me to make a video on vaginismus, just let me know. I'm writing it down, vaginismus. If you want me to make a video on it, just let me know. The questions are never ending. Holy Saya said, I am really enjoying your lecture. Thank you very much. Alice, I've answered your question. Alice, I've answered this particular question. Must you experience implantation bleeding to show you are pregnant? I said no. Then I explained it in details. If you want to know the details, I would advise you watch the video, because like I earlier said, if you ask the question, just wait for it to get your turn before you go away. Because it's kind of draining. Yeah, it's draining. Me repeating, answering that question over and over again. It's not really nice. All right. So people said mine is usually 28 to 26. I guess it's not normal. It's normal. It's fine. It's fine. Another thing that can delay your menses can be stress. When you are stressed out, you are worried, you have a lot of things to think of or do, that can actually delay your menses. But for you to have, okay, it's certain within 26 to 28 days, you are going to get it, then it's fine. It's regular. Sorry. Simon said, is it an issue when women experience period and stop within 2 days? No, it's fine. Period between 2 to 5 days is fine. So it's not an issue. It's okay. All right. Cynthia said, after giving birth through CS, when is the best time to have another baby? When you are ready. Seriously, when you are ready, you started ovulating, you started seeing your period, that shows you that your body is ready to take in another child. So basically, what they advise is that child spacing is important. At least you should give your child 2 years intervals before you give birth to another baby. It's going to allow your body recover swiftly. That is what the World Health Organization agree. Yeah, I think that's it. Yeah, I'm not sure, but 2 years is like, I can't remember. I made a video on that about child spacing. Oh, so many things on my head. I made a video on child spacing, but they advise you give your body time to recover fully before giving birth to another child, be it CX or vaginal delivery. So it doesn't really matter because it's CS, you have to wait 10 years. Be it CS or vaginal delivery, they advise child spacing. But if you know you don't want child spacing, you want to give birth back to back, it's a personal decision, I must say. But when your body is ready, you can go and go ahead. All right? Jesus. See why I'm shouting Jesus. The questions are getting plenty. See, I'm not going to answer another question again. If you've asked the question, like I earlier said, stay behind, watch the answer before you go off. I'm not telling you to stay to the end of the video. Just wait for your questions to be answered before you go offline. All right? The video that will be dropping today, let me tell you, before I go, I made a video. The video that will be dropping today by 5 p.m. is 3 bad marriage advice I received. Seriously, if you are a married couple, there are 3 bad advice that you normally receive. It's common, but they are bad. I made a video on that. So watch that video and don't take those bad advice. That's the video that will be dropping today. It's going to be dropping by 5 p.m. So take notes and be online to that. Somebody's asking, how much is diploma in nursing in the UK? I don't really know. I don't want to guess. I don't know the amount for diploma in nursing in the UK. I don't know, so I can't say. All right. Sorry about that. Sister, what are the best time to have sex? When you want. It's as simple as that. When you want, both parties are interested, both parties are in the mood. The best time to have sex is when the woman is in the mood and the man is in the mood. Seriously, it's going to make it more fun and pleasurable. So when you both are in the mood, is the best time to have sex because everybody's spirit, mind, body, and soul is there. So that's what I have to say. But DJ. Okay, Ghana, STG TV Ghana, please, what is the cause when woman feels pain inside her vagina while having sex with her partner? Okay, STG TV Ghana, there are a lot of causes which I cannot explain deeply on this live, but I made a video on painful sex. Painful sex. So you can watch that video and get idea about painful sex, what is causing it. Because when you know the cause of the painful sex, like I said in the video, it's gonna be easy for you to tackle it. So I made a video on painful sex. You can watch the video on our YouTube channel, STG TV. Say, what is the good medicine? Let me check. Is that my daughter? Okay, no. Okay, what is the good medicine for the treatment of vaginal odor and what is the cause, please? When it comes to the treatment of vaginal odor, we have to know what is causing it. There are different causes. It could be bacterial, it could be fungi, it could be something else. So we have to know the cause. The cause determines the treatment. What type of smell? Is it foul smell? Is it a fishy smell? So the type of smell, the cause depend on the treatment. The doctor, I'm a nurse. I'm not a doctor, please. I'm a nurse. Okay, nurse, I will read it for you. Nurse, my cycle is 28, but in some blood of the days or the day 14. Maburu, your question is not clear. Please read through and type again so that I understand. I don't understand your question. Sheon said, what can someone use to prevent pregnancy? Family planning. There are different family planning methods that you can use and adopt. It's going to help you prevent pregnancy. And also knowing your cycle is one of the safest way. It's not safe, sorry. It's not 100% safe. Know your cycle is one of the easy way. Let's use that word. It's one of the easy way to prevent pregnancy. It works a lot. And I have been using it. Oh, oh my God. These questions are a lot. I don't know where to start. Where did I stop? Okay. Bobo says, what can cause itching and sweating between the breast before the menstruation and finally no pregnancy? Why? Okay, anything in regards to the breast, I'm not going to be answering anything in regards to the breast today because we are bringing an expert on Wednesday, 5 p.m. to the YouTube channel. So all you just have to do is to be online on that day. Anything in regards to the breast, I'm not answering today. So all your questions in regards to the breast, keep it for the expert in that field, which is Dr. Tasha. She's going to be coming on Wednesday. Yeah, she has over a decade, like more than 12 years experience. Even in my nursing, I've never had up to 10 years of experience. But we have somebody who is a breast expert, a surgeon, is going to be on the ground to take all your questions on the breast. All right, just wait till Wednesday. Okay, somebody is asking, please, when does contraception pills leave the body after stopping? Because I don't understand. See, generally, everybody's body system is different. That's what I've come to realize. Some people, they stop contraceptive pill today, the next day, the next month, they are pregnant. Why some people, they stop it today, 1 year, they are not pregnant. So for me, everybody's body system is different, the way these contraceptive pills work for their body. So what I would advise, when you are ready to get pregnant, stop the contraceptive pills and see. Give yourself 1 year to try and see how it goes. Okay? In case you, after stopping, you're having difficulty, just give yourself at least a year of frequent, regular sex. Hopefully, something is going to come up. So, different body system is different. Okay, Udom said, well done, Miss Mary. You are doing a great job. I am motivated to go back to my YouTube channel after the first one was terminated. Oh, I can imagine how that feels. Seriously, we need more of you on the YouTube channel, so we'll be waiting. All right. Somebody said, please, I had ectopic pregnancy last month. When can I conceive again? Conceive again when you are ready. After ectopic pregnancy, after some time, you start seeing your menses and you start ovulating. That shows that your body is ready to conceive again. That shows that your body is ready to have another baby. All right. Okay, Michael said, my second question is that I and my husband does not want kids yet, and I don't want to use family planning method, but just want go with my meditation because I'm scared that I don't want story. Okay. Is it possible to go on this journey with my menstruation cycle and I would get pregnant? Please, can you make a video on the issue to like in terms of things like this, if you know your cycle is regular, like you said, it's easier for you to like know your cycle. Understand? When you know it's close to your ovulation period or on your ovulation period and you want sex, it's advisable you use the withdrawal method too. Close to your ovulation, use the withdrawal method. When you're on ovulation, even avoid sex if you can, as much as possible. You avoid sex. That's my advice. If you don't want to use the family planning method, then you can also try using the condoms, especially around your ovulation period. Fatima, I've answered your question. Damilola, when you say a lady's period is not flowing well, what do you mean? Because I don't really understand what you mean. Boric acid cannot cure all discharge. It depends on what is causing that discharge. That's what boric acid can do. All right, I've made a video about boric acid. You can watch the video because I've talked about this before. You can watch the video on boric acid on our YouTube channel, please. Oh God, I think Alice will ask her question and she will go. I'll come back and ask it again and she will go. Alice, if you are online, just say hi. I will answer your question because I don't want to answer it twice. Alice, if you are online, drop on the comment section and I will answer it because I've answered this question twice, and it's not nice. Okay, Alice is online now. Thank you. Must you experience implantation bleeding to show you are pregnant? I answered it and I said, personally, I experienced it. I didn't really experience implantation bleeding. I didn't see it. I didn't notice it. And it could be because of the kind of panties you are using. Hello, can you hear me? Please, I had a call, so it intruded. If you can hear me, say you can hear me, Alice. I just want to be sure. Please, if you can hear me. Okay. Like I earlier said, implantation bleeding is not a stamp like you are pregnant. Some women are pregnant, they didn't even see the implantation bleed because it's pink, it is light. So it drops on the pants. If you are wearing a dark pants, you might not notice it. All right, maybe a white pant, you might notice it. So some people experience implantation bleeding and they don't even know. Some people don't even see it. All right, so that's not a stamp that, okay, if I am not seeing my implantation bleeding, I didn't notice my implantation bleeding, I am not pregnant. Okay, Alice, your question has been answered. I'm glad you are following. So the Jenny report, what is the monthly pay in UK for nurses? It varies. It actually varies. It varies if you did a lot of nights, if you did weekends. So that's going to affect the pay. We can't say this is the actual pay. If you do if you do some extra shifts, so that the pays varies, it can be stamped. But I think the basic should be 1617 after tax. 1716 after tax, pounds after tax. But it varies. Yeah, I think the least you can go should be 16 something after tax. If you did not do weekend, you did not do nights. Do they employ certificate nurses in the UK? When you say certificate nurses, what do you mean? They don't employ nurses that were trained in the hospital. All those ones, they are auxiliaries, they are quacks. So they don't employ nurses like that. They employ nurses that went to school of nursing or university. School of nursing or university. Those are the nurses that are employed in the UK. All right. Alexandra, thank you. I didn't see you today. How are you doing, honey? Hope you are doing great. Alexandra, what do you do? Alexander is one of my topmost fans on YouTube, always commenting on my video, always on my live. I really do appreciate him so far. He's one of my topmost subscriber, and I appreciate him whenever I see him on my live videos and also under the comment section. So please, I've noticed Alexandra over time. So if you want me to notice you, always drop a comment on my videos, share, like, and watch them. Okay, Favor said withdrawal has been working for me so far. Thank you, ma. That's good. So you can continue if it's working for you. But just get prepared that anything can happen. Lordina Aqua said, I did it last month. I saw my period this month. It's normal. What did you do last month? I don't understand. How can I count my cycle? We have a video on YouTube that explains to ladies how to count their cycle. So all you have to do is to watch how to know my menstrual cycle on our YouTube channel. Said, please, can you talk about IUD implantation and side effects? Okay, I'm going to talk about that. I'm just going to write it down. I'm going to write it down. I have a lot of videos, like you can see, if you look very well, you see this is number 31. Good. This IUD now is number 32. A lot of videos. I'm wondering how I'm going to answer all these questions. Can you talk about IUD implantation and side effects? All right, I'll try. I'm trying my best to attend to a lot. Well, it's a lot on my decks, like a lot of questions. What is the negative of using condoms? One of the negative I know is that some people are allergic to some of the things that they use to make condoms. Some people have allergic reactions. That's one I know. If the condom is not properly used, it can rupture and it can finally lead to pregnancy. And that's what I know. Condom generally does not have that big negative effect. Ectopic pregnancy. Aqua, I made a full video on ectopic pregnancy. It's on our YouTube channel. Because if I start explaining it in details here, it's going to be like what we're going to be talking throughout. So ectopic pregnancy, in simple terms, is simply when the baby does not develop in the womb. The baby is not growing in the womb. It's growing in a place different entirely from the womb. It can be in the fallopian tube. So when the baby is growing in the fallopian tube, you can call that ectopic pregnancy. The baby can develop in other areas in the body outside the womb. That's ectopic. But the common one is the one that develop in the tube, the fallopian tube. And when the baby start growing there, there's no way the child is going to survive. Definitely they have to take it out. All right. What happened to a woman when they asked her to do a test of hormonal profile? The result determines what you are going to be saying, because they just want to know your hormones. They want to know what, like, if your estrogen, your progesterone, your normal human hormones are within the normal range. You get, especially if you are having irregular cycle, you are missing your period, they may want to do a hormonal profile to know what is happening. Okay, so the result will determine what they're actually finding. But I don't feel any sign of ovulation during my ovulation. I get to know ovulation whenever I count it, or whenever my period is appreciating, I start noticing breast tenderness. Some women are like that, but I think you should focus on the temperature changes, because temperature usually, there's a difference in temperature around that ovulation before ovulation period. So I believe that's going to help, because most women, they don't usually just observe the signs or see the signs of ovulation. So that doesn't mean something is wrong. All right. Oh, it's almost 1 hour. Okay, I think I've answered all the question now. That's the last question and I've answered it. Ah! Please, if you are on, I like this video. We have a lot of people coming for the past like 1 hour now. This like I've not gotten to 30. Please like this video. Like this video. Please like. We've been here since. So I'll be going off in the next 3 minutes. Yeah. This will be all for today. Thank you so much. How much do they do the test for hormonal profile? I don't know. I don't know the tests, how much it costs to do the hormonal profile, please. Different hospital with different costs, different hospital with different prices. Okay, I'm going to make a video on vaginismus, and that video is on number 31. So if you don't see your video on time, it's 31. So we have a long way to go. I've not been able to, like, it started from 1. So your vaginismus video is number 31 video. If you don't see your video on time, kindly bear with me, because we have a lot of questions that we're making full videos on. And when we make videos, kindly try as much as possible to engage this video, please. Like, share, and comment. Okay. Any other question? I'm going off YouTube in the next 2 minutes. It's been a long day, because I just finished shooting and I said I should use the opportunity to come out and do a live and answer as much questions as I can, because the video might not be necessary. Like, some people just have short questions and I can easily answer it here, but some videos require longer time, longer duration. So we'll be using the live to answer short videos, because I have a lot of questions. We'll be using live to answer short videos, and we'll be using the long videos, like normal daily uploads, to answer plenty questions. So we'll be going off in the next 1 minute. I want it to complete 1 hour before I go. So it's 1 hour actually budgeted for this. If you have any question, just drop now. In less than 1 minute, I'll be going offline. Drop your question before it clicks 60 minutes. Once it's 60 minutes, I won't be able to pick any other question again. I'll be going off. All right. Okay. 35, 36, 37. What level do they employ nurse in the UK? Band 5. They call it band 5. That's the least band that they do with nurses. The band 5 nurses, that's the list. You get the band 5. Bye. It's 1 minute. Remember, I said once it's 60 minutes, I will be ending the video. Bye, and see you in our next video, in our next live, and also in our next video. Remember, a video will be dropping today at 5 p.m. So stay in touch, watch, and see you in our next live.